love Doc. I'm not sure we can help you there, but it is Ask the Doc time.
Hey, don't underestimate Dr. Mimi Ghosh.
There you go. Exactly. Dr. Mimi Ghosh.
You're welcome.
She is with the American Family Network, OSU Medical Center, and on the phone we do have Colleen Erickson. She is from Marysville, and she has a question for you, Doc, about the shingles vaccine. Colleen, good to hear from you.
Oh, thank you.
You are very welcome. Thanks for waking up with us, and go ahead and ask the doctor a question.
Okay. I'm 83 years old. I don't know if that's a factor. I had shingles about 8 years ago, and I keep seeing it talked about so much about getting the shot on TV, and I'm wondering, can I get the shingles back again, or should I have the shot?
This is a great question. I love this question. I'm probably asked this 2 or 3 times a day.
Really?
It's a hot topic right now. Shingles is a reactivation of the chickenpox virus, which lies dormant in your system for years until people are elderly or immunocompromised or their immune system is in some way challenged. And the shingles vaccine is indicated for anybody over 50 now. The FDA has lowered the age from 60 to 50.
Okay.
It is a one-shot vaccine, so it's supposed to have lifelong immunity. Now, we're not sure if that's going to necessarily be the case, but we'll let you know in 20 years if that's actually working or if you need to get a booster. But we do recommend anybody over 50 to get the shingles vaccine. There is this thought that once you've had shingles, you can't get it again, and
Yeah,
that's
I've heard
actually
that.
the opposite.
Oh.
You actually are at higher risk of getting it again because if you've gotten it the first time, it's probably because your immune system is challenged, because you do have medical issues, and therefore you have a chance of getting it again.
Well, there you go, Colleen. So we're saying go get it.
Absolutely.
And
Colleen-
age is not a factor for
Age
her.
is actually not a factor.
Okay.
It is in a way in that the older you are, the more we recommend that people get this vaccine because the older you are, the more chance it is that you'll have medical conditions and immune deficiency. But it is a painful rash. It can be very uncomfortable,
painful,
very
yeah.
painful. The older you are, the worse it is. And the treatments for it become more difficult as people are older because they don't tolerate the treatments very well. So I think getting the vaccine as early as possible would be a great idea.
Okay.
Important point, most family doctors and primary care offices do not carry the shingles vaccine in their office because it needs to be stored at a very specific temperature. So the vaccine is actually at the pharmacy. And the doctor writes the prescription. You take the prescription to the pharmacy, and the pharmacist is licensed to give you the vaccine.
Oh.
So that's the process. So you need to ask your provider to give you a prescription if they don't have it on site, and you can go get it at a pharmacy locally.
Great. Colleen, is that what you needed to know?
I'm wonderful, and I'm really happy to hear this because, you know, like I say, it's talked about so much.
Yeah, there you
And-
go.
and
Well,
that question. Thank you so much.
Oh,
You're welcome.
You
I
are
love this show. I love you, girls.
Thank you so much, Colleen. It was great to hear from you.
Bye-bye.
All right, next question, Doc. We are also hearing from Sherry on Facebook. She says, I have a very bad cough. It came out of nowhere. I don't feel sick. What is the best thing to buy for this terrible cough? And I will say, it's not just Sherry. We've had people here at work with this horrible cough.
Yeah.
What is going on?
Well, I'll tell you, walking into the pharmacy and seeing aisle after aisle of medications is overwhelming, even for people like us that are trained in pharmaceuticals. There's a lot of products out there. I think anything that's natural in terms of products, lemon-based, honey-based, the Whole Foods type products are always a safe bet because they don't interfere with anything.
Okay.
Products such as Delsym and Robitussin are good basic cough suppressants, but the important piece here is that a lot of these cough medicines and cold medicines and allergy medicines can interfere with prescription medications. So just because you don't need a prescription to get a cough syrup doesn't necessarily make it safe for everybody. So please go and ask your pharmacist if there's any interactions with any of the other medications. A pure cough suppressant is usually pretty safe unless there's allergy issues, but then once they start to mix in other chemicals like decongestants and antihistamines and all these other products, and you kind of think, okay, well, this is on sale and there's all these other products in it, so the more the better. That's not true. So once you put a decongestant into a product, it is an indicator for people that have prostate issues, glaucoma, high blood pressure, thyroid, heart disease. So again, it can be very complicated to just go and get a product and not look at the other factors. So ask your physician, ask your pharmacist. The other thing that's important too is a cough is a symptom.
right, that's what I was going to ask.
it
How long
doesn't-
do you let this go on?
Exactly. You don't want to be suppressing something that we don't know where it's coming from.
Okay.
So cough can come from something as simple as allergies and postnasal drainage, which is probably what it is right now. That's the commonest thing we're seeing because of all the pollen out in the air.
Right.
So it could be something as simple as that. It could be asthma. It could be bronchitis, or it could be reflux, or it could be something as serious as a lung cancer. So the last thing you want to do is suppress. So don't take it more than 2 or 3 days before you go and see your provider.
Okay, thank you so much.
Great advice, as always. And Dr. Mimi Ghosh is with us often, so she'll be happy to answer your questions as well.